second speaker for this afternoon is Dr. Roni Moya. He obtained biomedical degree from University of Mogi das Cruzes, Sao Paulo. He did specialization in anti-aging medicine from Seville University, Spain. Later, he pursued for Master Science in Molecular and Cellular Immunology, Biology at the University of Coimbra, Portugal, and Master Science in Clinical Advanced Nutrition from the University of Barcelona. He also obtained PhD in Biomedicine and Immunology from Gulbenkian Institute of Science and Coimbra University. He is the coordinator of Molecular Medicine of Regenera Research Group in Aging Intervention. He is a professor and director of the graduation program in Molecular Therapy in CESP Uni, and also a scientific advisor for nutraceuticals and cell therapy companies in Europe. So this afternoon he will give a talk about intravenous antioxidants, laetrile and artesunate as integrative treatment in oncology part 2. So he will give the talk for the next 30 minutes. Please welcome Dr. Roni Moya.
Hi guys, hello, good afternoon. After this morning, I'm going to make the second part, the protocols to the IV for cancer treatments, okay? So, in the morning, I spoke about the vitamin C, of lipoic acid, glutathione, and selenite. Now I'm going to speak about the hardware, okay, the hard stuff. So let's begin just to remember the trajectory here. Don't forget, every disease begins with stress and inflammation, okay? Everybody are talking about that, intoxication and so on. So you have here the chronic inflammation and the oxidative stress. The first thing that happens is the loss of the DNA repair. Once the cell cannot repair itself, begins with the mismatch of the chromosomes. Once you have this instability, you can progress either to the inflammatory mediators that goes to here, to the genomic instability and all the other things that I told about you. For example, the immune escape that I spoke to this morning, until the other part of the oxidative stress, which will be the DNA damage, the mutations, and after the mutations, the initiation, the promotion, and etc. Okay, so either to the inflammation or to oxidative stress, you begin with the instability, genetic instability, and lack of repair in the DNA. That is the problem. So you have to control it with the stress and inflammation, and mainly the evasion of the immune system. So let's go to the protocols again. First thing that I want to highlight is the DCA, which is dichloroacetate, okay? What is that? The mitochondria targeting a small molecule that inhibits the pyruvate kinase. It's so complicated to speak about chemistry, but let's do that in an easy way, okay? What the DCA does is that increases the flux of pyruvate into the mitochondria and then promotes the glucose oxidation. Tumor, as you know, need glucose. Once you have this product here, the glucose will go under oxidation. And after oxidation, the tumor that needs this glucose, we won't have that glucose, and then he will die. That is the main thing here, the suppression of the tumor, because he has not glucose enough to eat. So here you can see the protocol, the scientific article, and this part here is the normal thing, okay? They have glucose enough, and then they don't have any apoptosis, and they go to proliferation. Here, once you have the DCA, the pyruvate will decrease the activation of the glucose, will oxidize the glucose, and then the apoptosis will go higher, and the proliferation will go down. That is the main thing about this treatment here. And as you can see here, this is the tumor eating glucose. Once you inhibit this glucose, the tumor will go under apoptosis. So, in summary, What we have here is the reduction of the tumor size and markers, the prevention of the angiogenesis. Once it has not glucoses to eat, he will go under apoptosis, and he won't have also vases enough to fuel himself. And then the reduction of the cancer-related symptoms, okay? This is a very interesting treatment, also to manage pain and add palliation, okay? People that are under palliative treatment can also take DCA to manage the pain. The course of the treatment, twice a week, IV, okay? You put in 500 milliliters, and then you put the DCA there, and then you start the dose with 20 milligrams per kilo. And then you see the patient, you understand if it has or not side effects, and afterwards you can increase a little bit. For the palliative way, I won't increase anything. Just I check the symptoms. If the pain is better, I will keep the doses. But if not, if there is a patient under chemotherapy, radiotherapy, everything, then I will enhance the doses step by step. I do that because we have the synergic effects of the other things that I put before in the morning, okay? So I don't do just that product or the other product. I will always do the synergic treatment, integrative treatment. So I put in another physiological solution, the glutathione, the alpha-lipoic acid, the B complex, following the IV with the DCA. Why I do that? I do that just to decrease the consequences of the symptoms of the chemo and radiotherapy. You know, here I don't mind it. I'm not thinking about treating cancer. I'm thinking about detoxify the patient to make him feeling better. Just that. Okay? With the DCA, of course, I want to help the patient to decrease the possibility to proliferate its tumor. Okay. Also, you have a problem here with the negative effects of other things. For example, benzos. They take benzos for pain management or because they are anxious and etc. And if you do DCA with benzo, you have a very drugged patient. You know, you will intoxify the patient a little bit more, and he will feel very bad. He will vomit. He will have nausea. So you have to pay attention on that. All the neuro drugs can have the same problem, and the cannabis. You know that cannabis is very important to manage pain. Somebody use cannabis. If you are using cannabis, don't use DCA. Okay? So, there are some provisory effects, and you have to understand that. Okay? Patients will say that, doctor, I did the IV and I'm not feeling so well now. I'm having fatigue, confusion. I'm like drugged. This is completely normal. 30 minutes afterwards, you will feel better, you know? But you have to speak about that before to make sure that the patients understand that you will have those kind of symptoms. Not everybody, but most of them, they have some, you know? Mainly the dizziness. They will say to you, I'm feeling worse. You just have to be very calm and say, look, let's wait a little bit, 30 minutes, and you see that you won't feel so bad, okay? Well, other things like tremors, hallucination, agitation, that would be like very rare to see, but it is written in the articles. Hypocalcemia, minor liver enzyme elevation, transient neuropathy, that is like for 1 or 2 days maximum. When you have patients with those kind of side effects, then it's 2 or 3 days with those, okay? Nothing to be concerned about. The other thing, after the DCA, would be the artesunate. It's more used. It's not so hardcore as the DCA. The artesunate is a very active product of the artemisia. Who does acupuncture knows a lot of that. It can reduce cancer due to oxidative stress and apoptosis. Most of the plants do the same, you know, they go under the apoptosis way. And it improves very well the sensitivity to the chemotherapy. I told you before that the cancer has tools to overcome the chemotherapy. One of those tools are actually have resistance to chemotherapy. As you enhance the sensitivity, you are helping the tumor to get attacked by the chemopharmaceuticals. Alright, so the Artemisia has a lot of polyphenolic groups. They are very important because they are anti-inflammatory. They have a lot of different kind of polyphenols that can be used with the chemo drugs. Okay, so it's safe to use with the chemo drugs. And artemisinin is here, and artesunate is here. The artesunate is the drug calling, is the pharmaceutical form of the artemisinin. Okay, this here is being used to treat malaria. I don't think you know that, but I was in the Medicine Without Borders, working with malaria before in an island, and we didn't have any medicine, but we had Artemisia. So we could treat patients with that because the artesunate takes iron from the cells. So once they take iron, it takes iron from the cells, the patient will attack the parasite. The parasite needs iron to survive. So this is the more or less the same way in cancer. You take off the iron from the tumors, and they go under apoptosis. Here you can see the several good effects of the artemisinin. Here you can see antiviral, anti-allergic, anti-tumor, anti-cancer, anti-fungi, etc. Okay, there are a lot of works about artemisinin, and the mechanisms is very easy. The first one would be in the invasion and metastasis by decreasing the metalloproteinase proteins, which are the most important inflammatory proteins. They destroy collagen, and they inhibit all the activation of the antioxidant enzymes. So the other one would be to reduce the factors of hypoxia and the VGF and so on, to decrease the angiogenesis processes. The other one will be in the proliferation cell cycle, and of course activate the apoptosis. Every plant does the same. When you use resveratrol, curcumin, is all the same. Alright, so those are the cancers they are searching with the artemisinin, in vivo, in vitro, several cancers. And here you have some articles. Let's go until here. As much as you increase the doses, as much as you have the exposure to the tumor, better is the apoptosis. The same thing as the vitamin C. You have to have good doses of artesunate, otherwise it won't happen. It won't happen. Okay, nothing happens. So here you see all the exposure time. I always tell the doctors, when you do the IV, you have to do higher doses. Orally is different, but IV you have to pump. And then you can handle a little bit the side effects because they are transitory side effects. Let's see a little bit the indication of the artesunate, then I will pass to you the protocols. First, the artesunate is an active product of Artemisia. This is a summary. Reduce cancer due to oxidative stress and apoptosis, and improve chemotherapy sensitivity. So the indication would be to chemo-resistant cell lines, fast-growing tumors, and colon cancer. Okay, mostly solid tumors because they have iron. Breast cancer, melanoma could be prostate cancer. It's also being researched, and it has sensitivity to gemcitabine. It's good, the synergistic effect with the chemos, and can be combined with all the chemotherapeutics. Let's see. IV for 21 days, 5 milligrams per kilo. I don't do that. This is theoretical. I will pass to you what I do. Again, as I do synergic treatment, I don't do every day the artesunate. Even because the artesunate takes off the iron. It's hard. They are already anemic if they go under chemotherapy, you know? So it's a paradox here. You have to give iron, and it takes iron. So you have to balance your patients, see the analysis to understand if he's going into anemia, deep anemia or not. You have to control. So what I do is to do the IV once a week and control the liver enzymes and the hemogram, just that. Here's another, this is more or less what I do. 1 or 2 twice a week the IV, starting with 50 milligrams of artesunate. Okay? That is a very good dose. I don't do by kilos, I do by 50 milligrams. I begin with 50 milligrams, and then if there is no symptoms, I increase to 200 milligrams. 50, 100, 150, 200. Okay? Then I'm checking if the patient is anemic or not, and then we go for them. You can also do IM, intramuscular. Okay, for 15 or 21 days, I don't do intramuscularly, I do IV. And the dose would be a little bit further, from 60 to 75 milligrams intramuscularly. And you have to make sure that you have to give iron, nor again, contradictory. The artesunate takes off the iron, but you cannot let your patient go through a deep anemia. So you have to give a little bit iron to your patient. This iron goes to other places, not just to the tumor, because the tumors are more sensitivity to the more sensible to the artesunate. So you will destroy the iron from the tumor before the iron from the patient. That is the thing. Of course, I do the synergic thing. Vitamin C, glutathione, alpha-lipoic acid, B complex. This is the tricky thing. You know, this is the thing that I do to not perform the treatment every day. Once I do one time or twice a week, I synergically put things together. See here, iron supplement daily, and you have to check out the analysis. Alright, so provisory side effects: hemolysis, anemia, hepatic toxicity. You have to make sure that your patient has all the enzymes okay. Alright, the other one would be the B17 vitamin, very known today. It calls amygdalin. Okay, here is in Portuguese, sorry, it's amygdalin, comes from the apricot. And the thing is that inside here you have a lot of cyanide. So you intoxify the tumors with cyanide. Let's go under the treatment. So the laetrile is the active product of the amygdalin, releases benzodiazide and cyanide in cancer cells, which activates cancer toxicity and apoptosis. See, every plant that you use go to the same mechanism: apoptosis, intoxication, oxidation. Here you can see, as much as you increase the dose, as more you have the apoptosis. It's everything the same. I change the product and the response is the same. Here you can see the doses. As much as I increase the doses, it reaches its peak in the case spaces, which is the cascade for apoptosis. Let's see here, the same thing. You enhance the doses, you enhance the apoptotic cells. Here is those mouses with amygdalin and control. You can see the decreasing of the tumors. Let's see the method and course of the treatment. The first week, you start with 3 grams. 1 or 2 sessions per week. 3 grams is enough to have side effects, which is the most important side effects is the dizziness. Okay, patients will start to be dizzy, and like, well, doctor, I feel that I got a little bit marijuana. What should I do? What should I do? They are like a little bit afraid, and you have to say, calm down, 15 minutes, you'll be better. Maybe 15 minutes, 30 minutes, 1 hour, and afterwards they will be better, okay? So, if 3 grams is too much, then you stay at 3 grams. If the patient doesn't feel anything, it's okay, then you can enhance a little bit. And the second week, you go to 6 grams. And then you go to over 6 grams. In Germany, they do 36 grams. I don't do that. I never write to those very high concentrations because I am afraid. Okay, I'm really afraid. So I go until 90 grams. That I do. But over 9 grams, I didn't do, and I don't advise to do. Or if you are very experienced in this kind of treatments, or make sure that you go until 9 grams. This is another kind of treatment from the time of society therapy. They do like the first stadium, second stadium, third stadium. See, they do every day, the 1st until the 20th. And they enhance the doses until 15 grams, okay? And then from the 21st day, once a week in the beginning, and afterwards once a month. And they give also Laetrile orally. That is the textbook treatment. Also, other doctors that have more experience than me in Laetrile, they are keen to enhance the doses. I don't do that. I keep it 6 or 9, and I synergically combine the treatment with the Laetrile with others treatments. So, provisory side effects, as I told you, dizziness, headaches, nausea, vomits. Nausea and dizziness are the most seen, okay? Mental confusion, I saw 3 or 4 patients with that. They get they lose the memory, they don't know where they are. Don't be afraid, in 10 minutes it passes, okay? Hepatic toxicity is not so easy to see in 9 grams. Over 9 grams, you have to control, okay? Fatigue, this is normal, because when you get your serotonin high, you go under fatigue, you feel yourself a little bit dizzy, and you have a little bit adrenal fatigue, but momentary, okay? Right now, I put again the same thing following the IV Laetrile. So I put all the antioxidants to decrease the symptoms, the side effects, so the patients feel better. After doing the IV with the Laetrile, when they do that, they feel better. They don't get so dizzy, they don't get so nausea, etc. The other one, I think you know, the Viscum album. Okay, it's really famous in Germany. It's an European mistletoe. The Viscum album is a semi-parasite, okay, that grows on different host trees, and it's composed by mistletoe lecithins and viscotoxins. Here you have the flavonoids, several enzymes, peptides, amino acids. You have a lot of stuffs that are anti-inflammatory, that activates the immunity, because peptides, as you know, acts like vaccines. They activate the HLA, histocompatibility, and they activate the T cells, B cells, and whatever. Mainly the natural killers cells. Okay, so it goes under cytotoxic properties, induction of apoptosis, inhibition of angiogenesis. See, every plant, we change the plant, the same consequences. It's always the same. It has the anti-inflammatory effect because it is inhibiting the cytokine-inducing prostaglandin 2. Okay? It's a very immunostimulatory molecule, and activate very much the monocytes, nuclear factor kappa B, and also the natural killers. The nuclear factor kappa beta is pro-inflammatory, okay, you know that. But once you just modulate a little bit its expression, you will enhance the activation of the immune system in the way that the tumor will be attacked very easily. Well, let's see, there are some other articles in a lot of female and male tumors. So it's very studied already, the Viscum album, in a lot of kinds of treatments, chemo, with the immunotherapy, radiation therapy, hormone therapy, every kind of treatment can be done with the Viscum album. So I go a little bit to the course of the treatment. I'm almost done. The first week I do the 1 milligram IV, 1 to 2 sessions. The second week you enhance a little bit to 2 milligrams, and the following 5 until 400 milligrams. Pay attention, because the 1 milligram can give allergic response. Okay? If the patient is okay with 1 milligrams, then you enhance. But normally in the first week, when you do 1 milligram, the patient will feel himself swollen with redness, a little bit fever. This is completely normal. 2 days afterwards, it will be better, and then you can enhance the doses. That is the course of the treatment. So every time I put the other antioxidants together, and then finally I have the curcumin. You know that curcumin is a very famous product today to modulate the inflammation, problems with Parkinson's disease, Alzheimer's disease, and also cancer. So, curcumin is being prescribed intravenously in a liposome way, because otherwise it won't be absorbed. Okay? In capsule, you have to give piperine to enhance 100% its biodisponibility. So if you go on the IV, you have to make sure that the curcumin is under liposomal molecule. The IV liposomal molecule would be 40 milligrams per kilo, done 3 times a week, no effects. This is a very safe product, okay? 3 times a week, 40 milligrams per kilo, you can go until 10 grams, 15 grams, there is no side effect with the curcumin. It reduces the expression of the nuclear factor kappa B cascade, modulating the nuclear factor kappa B, and reduce the growth and induce the apoptosis of pancreatic tumors in vivo and in vitro. You can see here, as much as you increase the doses, the same thing, as much the curcumin will be in a pro-apoptotic to cancer cells. Every time the same, guys. From the vitamin C, the curcumin will be always the same. Here you have the effect of the liposomal curcumin. You increase the doses and you decrease the cell survival. Okay. Here you can see the same thing with other kind of cells. Always the same. Always the same. Okay. More days, more apoptosis, every time the same. And here you have the control, and you have with the liposomal curcumin. Alright, here you have again saline control and liposomal curcumin, the pancreatic tumor, the effect of the apoptosis. And then finally, the last one would be the green tea. Okay, add gallocatechin trigalate. You know that orally it's very important, but endovenously is amazing. No side effects also. Okay, the same way it goes to apoptosis, it goes to anti-angiogenic, anti-metastatic, a lot of things. And here is the article here, speaking about the endovenously green tea. I say green tea, but you have to understand that it's not green tea. It's the substance that is purified, which calls epigallocatechin trigalate. Okay, not green tea. The substance has to be purified. So with that, 40% of tumors reduction in 20 days of survival in animals, not humans. Okay, so it's in beginning the process of put plants in IV solutions. Alright, so there is another complex that is very important as cofactors, synergic to everything. That would be the antioxidants, amino acids, vitamins. They all improve life quality. Okay, they are biochemical cofactors and can be added to the treatments. So you have here acetylcysteine, taurine, lysine, arginine, carnosine, carnitine, vitamin C, B2, 3, 5, and everything that you are seeing here. These here would be the cofactors that you add to your IV just to make sure that the molecules are being activating all the time, because they are the middleman. They are in between the reaction of the biochemistry response of the detoxification processes and also to the apoptosis process for the tumors. So it's very important to add that preventively, therapeutically, palliatively, whatever. So here you have an article about the carnosine and the activation of the apoptosis of the colon cancer cells. So the course of the treatment with these anti-aging cells, I will say separately, but I don't do separately. I put in the acid, lipoic acid, glutathione, C vitamin, I put everything together with this here anti-aging cell activation complex. So you can do IV once or twice a week, following every treatment that I talked about. So normally what I do very easily. For example, I do one cycle of DCA. So after the DCA, I put the lipoic acid, vitamin C, glutathione, etc. after the DCA. Once I finish the cycle of the DCA, I go to artesunate. Then I go to lithium. On between that, I will do analysis. I will certify that the patient is okay. Maybe if she has or he has a MRI or a TAC or CT, as you say here, then I check if the image is okay, I go over. This is the same way as chemotherapy cycles. You do the first one, then you understand, you see the patient, you speak with him, okay, let's go further, okay, let's go further. And you go to another kind of cycle. So, you can have the synergic effects with the vitamin C high doses, as I told you in the morning. and the other one, antioxidants that I told about. So the take-home lesson would be to use everything that you can integratively with the chemo and radio and other kind of treatments like ozone therapy, hyperbaric chamber, whatever you know. You have hyperthermic. So you have to make sure that your patient has been taken care with all the integrative medicine that we understand. So, as Darwin says, it's not the strongest of the species that survives, not most intelligent, but the most responsive to change. And the tumors are very intelligent and they change very well, so you have to prevent them to change, to attack them in the best way possible. If you want to speak about that with me, I will be at the Thymus Society stand, and I'm very happy to answer every question. Here's my email. Thank you, and this is Cacao from Brazil if you want chocolate, good chocolate. Bye-bye.
Thank you so much, Dr. Roni Moya, for a very interesting talk.
Any question? Thank you.
Now I'd like to call upon our third speaker. He is Associate Prof. Dr. Dimitri D. Upon completion his medical degree